Tyrosinase negative oculocutaneous albinism, or type 1 OCA, by Madison Humble. What is type 1 OCA? Type 1 OCA is an autosomal recessive disease. It is caused by a mutation in the tyrosinase gene, or TYP, which results in the lack of pigmentation in hair, skin, and eyes. The TYR gene is located on the long arm of chromosome 11 at position 11q14.3. It is the mutation of this gene that causes type 1 OCA, and the accession number of this specific mutation is M74314. Essentially, what happens is that a single base, thymine, is inserted into the gene, which causes a frameshift mutation. This introduces a premature termination signal, which results in the truncating of the final protein by several amino acids at the carboxyl terminus. Type 1 OCA is inherited in an autosomal recessive fashion, which means both copies of a gene in each cell have mutations. Often, the parents of an individual with this autosomal recessive condition each carry one copy of the mutated gene, but they do not show signs or symptoms of the condition. 1 in 20,000 people worldwide are born with OCA. This condition affects people in many ethnic groups and geographical regions. There are actually 4 types of OCA, but type 1 is the most common form. The phenotypes of those with type 1 OCA include white hair, white skin, and blue eyes. These phenotypes are caused by their lack of melanin, which is a cell responsible for providing the hair, skin, and eyes with color. However, their eyes sometimes exhibit a red color because the blood vessels inside their eyes can show through the colored part. The most accurate way to diagnose albinism is through genetic testing, which allows the detection of the mutated TYR gene. Patients can also be diagnosed through a physical exam and an eye exam, but this way is much less accurate. Unfortunately, there is currently no cure for albinism. However, treatment can help relieve symptoms and prevent sun damage. Melanin is also responsible for protecting the skin from the sun's ultraviolet rays. Therefore, it is important that those with this condition protect themselves from the sun by wearing clothes and sunscreen on exposed skin. Overexposure can lead to severe burning and even skin cancer. For this reason, annual skin examinations should be performed to identify any precancerous or cancerous lesions. Annual eye examinations should also be performed, as albinism can cause poor vision and depth perception. Corrective lenses or glasses can be provided in order to improve visual acuity, and dark glasses can even be prescribed in order to relieve light sensitivity.